Today, almost everyone has heard about magnesium. Some people take it for cramps, others for nerves, and some just because they read about it on the internet. But behind all this popularity, there is one but. Many myths and misunderstandings have accumulated around magnesium. As a result, some believe that you can easily live without it. Others think that any form is equally useful. And still others are sure that the more you take, the better. This is Dr. Helena. Let's calmly and scientifically figure out what is true and what is a misconception. Imagine, someone tells you that you can live without magnesium. Sounds plausible? That's the first myth. Magnesium is not only essential for humans, it is essential for the entire planet. At the center of every chlorophyll molecule, which makes leaves green and drives photosynthesis, is a magnesium atom. Without it, plants could not capture sunlight, would not release oxygen, and life on Earth would not exist as we know it. The richest source of biologically available magnesium is the hydrosphere, that is, oceans and rivers. Moreover, in our body, it is involved in more than 300 enzymatic reactions. That means it is a very important trace element. The second myth sounds like this: magnesium is only needed for muscle relaxation and cramps. Of course, there is a connection with muscles. Magnesium regulates relaxation after contraction, and in deficiency, spasms occur. But its role is much broader. For example, in the heart, magnesium is a natural rhythm stabilizer. Magnesium deficiency, hypomagnesemia, contributes to ion exchange disorders and cardiomyocyte instability, as confirmed by this article, increasing the risk of ventricular arrhythmias, supraventricular tachycardias, and a special form of ventricular tachycardia. This article states that in ventricular arrhythmias in patients with heart failure, intravenous magnesium chloride reduces the frequency of extrasystoles and episodes of ventricular tachycardia. In randomized trials in atrial fibrillation with rapid response, it helped reduce heart rate and even promoted a return to sinus rhythm. And in these clinical studies, it was noted that in fibrillations occurring after heart surgery, intravenous magnesium reduced their risk by 31 and 36%. Moreover, in postmenopausal women, low magnesium intake is associated with a higher risk of hospitalization for heart failure with reduced ejection fraction. Magnesium also plays an important role in regulating processes in the nervous system. Magnesium is essential for the transmission of nerve impulses and neuromuscular conductivity. It also serves a protective function, preventing excessive neuronal activation. Magnesium helps nerve cells maintain the correct ion balance, regulates connections between neurons, and controls the release of chemicals that transmit signals in the brain. It also affects special receptors, which are important for maintaining the balance of excitatory signals, influencing memory, learning, and stress resilience. Recent studies link low magnesium levels with depressive symptoms. Magnesium influences the hypothalamic pituitary adrenal axis in the brain, which controls the body's stress response and therefore anxiety and depression. Magnesium passes through the blood-brain barrier and plays a key role in neuron maturation and central nervous system function. Another positive effect of magnesium is that it plays a key role in regulating blood sugar levels and insulin sensitivity. This article describes in detail that magnesium is necessary for enzymes involved in energy metabolism and insulin secretion. Adequate magnesium levels contribute to improved pancreatic V-cell function, glucose tolerance, and reduced insulin resistance. And a review of double-blind randomized studies showed that magnesium supplements lower fasting glucose levels and improve insulin sensitivity parameters in patients with diabetes or those at increased risk of developing it. So magnesium is not a pill for cramps, but a systemic element that affects the heart, brain, immunity, and even glucose control. Quite logically, the question arises, is it possible to cover the daily requirement of magnesium only with food? At first glance, it seems easy. Magnesium is found in almost all plant foods, greens, nuts, legumes. But if you calculate, it's not so simple. This is the third myth. For example, a woman needs about 300 milligrams of magnesium per day. A man, about 350 milligrams. How much is that in food? In one serving of spinach, about 150 milligrams. To cover the entire norm, you need to eat 2 large plates of spinach every day. In a handful of almonds, about 75 milligrams. That means only with nuts you won't reach the norm. You'd need to eat 5 to 6 handfuls daily. And if you rely only on beans, you would have to eat more than 5 kilograms of beans to cover the daily requirement. The most concentrated product is pumpkin seeds, in a small handful about 150 to 170 milligrams of magnesium. But even so, to reach the norm, you'd need to eat 2 handfuls of seeds every day, and not everyone can manage that. And here comes an important point. Theoretically, it is possible to cover the requirement, but practically most people do not reach the norm. It is also important that magnesium absorption can be impaired if you have gastrointestinal diseases, gastritis, celiac disease, inflammatory bowel disease. There are also factors that increase magnesium loss, chronic stress, excessive caffeine and alcohol consumption, as well as some medications, for example, diuretics. So even with a balanced diet, you need to pay close attention to its composition to get enough magnesium. Thus, according to Walkinger's review in 2018, about 60% of adults do not meet the average magnesium requirements from food. In the Nutrition Review's review, it was indicated that almost 48% of Americans in 2005-2006 consumed magnesium in amounts below the recommended level. A logical thought arises: what if I get enough magnesium from food and I check it with a blood test? I want to note that this is the 4th myth. In fact, only about 1% of the total magnesium in the body circulates in the blood serum. The main reserve is stored in the bones and cells. Therefore, a regular test may be normal, even if the tissues are already suffering from deficiency. More reliable methods include measuring magnesium in red blood cells or using load tests, but in practice they are rarely used in clinics. In practice, doctors rely on a combination of factors: diet, patient complaints, stress levels, coffee and alcohol consumption. Symptoms are often more indicative than laboratory numbers. If you have nevertheless decided to supplement your magnesium deficiency with supplements, then do not fall for the 5th myth. All types of magnesium are equally useful. In reality, the form of magnesium matters. There are organic and inorganic forms, the latter being less absorbed. Organic forms include magnesium citrate, most often used for magnesium deficiency. One of the most universal options, often used for fatigue, stress, cramps. May have a mild laxative effect. Magnesium glycinate or bisglycinate, often prescribed for people with insomnia, anxiety, or high stress, because glycine additionally has a calming effect. Magnesium malate, bound to malic acid, which is involved in cellular energy production. Well suited for people with chronic fatigue, muscle pain, fibromyalgia. Magnesium taurate, considered the heart form, used for arrhythmias, high blood pressure, metabolic syndrome. Suitable for people with cardiovascular problems. Magnesium threonate, able to cross the blood-brain barrier. Therefore, this form is used specifically for improving memory, concentration, anxiety, insomnia. Inorganic forms, magnesium oxide, suitable as a laxative or for relieving heartburn. For replenishing deficiency, it is a weak option. Magnesium sulfate, Epsom salt, taken orally as a strong laxative. Intravenously used in medicine for eclampsia, dangerous arrhythmias, acute conditions. Not suitable for daily replenishment. Magnesium chloride, can be taken orally for deficiency. Used externally in the form of magnesium oil or baths, although scientific evidence of effectiveness through the skin is limited. Patients often report subjective muscle relaxation. 6th myth. Magnesium supplements are absolutely safe in any doses. In reality, there is a limit. The European Food Safety Authority has set the safe upper intake limit for supplements at 350 milligrams per day for men and 300 milligrams per day for women. From food, overdose is practically impossible, but with supplements and especially with kidney disease, excess magnesium can lead to hypotension, breathing disorders, and suppressed heart rhythm. That means the principle, the more the better, does not work here. So, to summarize, magnesium is not just a mineral for muscles. It is an element without which the life of plants, the work of the heart and brain, the stability of our metabolism, and even the very ability to remain calm under stress would be impossible. By debunking myths, we see that magnesium is not a trendy supplement, but a key part of our physiology. And the better we understand this, the more reasonably we can take care of our health. May your knowledge be beneficial and your health be reliable.